Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Point 7 Medications that may interact with green tea. Break. People use green tea and number 148, either as a beverage or in supplement form, and number 148, to support cholesterol, promote weight loss, and for other potential health benefits. But even natural products like green tea can interact with medications, so it's important to know which ones to be careful with. Break 1. Warfarin. Break. Warfarin, a blood thinner, can interact with green tea. Break. Why it matters. Green tea contains vitamin K, which can affect how warfarin works. Warfarin is known as a narrow therapeutic index drug. This means the difference between an effective dose and a dangerous dose is very narrow. When taking warfarin, it's typically advised to maintain a consistent vitamin K intake. What could happen? Drinking green tea may cause changes in your international normalized ratio, INR, a measure of how long it takes your blood to clot. This could make warfarin either less effective, and increase your risk of blood clots, or too strong, increasing your risk of bleeding. What to do? If you consume green tea, whether in your diet or as a supplement, check with your healthcare provider before combining it with warfarin. People who take warfarin are monitored very closely to make sure their INR stays within a safe and effective range. 2. Nadolol. Break. Nadolol, a beta blocker, is another medication with the potential to interact with green tea. Break. Why it matters. Nadolol is typically used to treat hypertension, high blood pressure, and prevent angina, chest pain. What could happen? Large amounts of green tea can make Nadolol less effective. In one study, drinking 700 milliliter, per day of green tea for 2 weeks reduced the amount of Nadolol in the blood by about 85%, which would make it much less effective for controlling blood pressure and or chest pain. What to do? If you take Nadolol, check with your healthcare provider before using or drinking green tea. 3. Statins. Break. Statins, a type of drug used to treat high cholesterol, can potentially interact with green tea. Break. Why it matters. Statins are the most widely prescribed type of cholesterol-lowering medication. What could happen? Green tea may lower levels of the statin Lipitor, atorvastatin, by reducing its absorption by about 25%, which may reduce its effectiveness. Some less than /speak evidence suggests that this type of interaction may also occur with the statins Crestor, rosuvastatin, and Zocor, simvastatin. What to do? If you take a statin, check with your healthcare provider about the safe consumption of green tea. 4. Evista, raloxifene. Break. Research has found that green tea may interact with raloxifene, although the way the interaction happens is not fully understood. Break. Why it matters. Evista, raloxifene, is a drug commonly used to prevent and treat osteoporosis, a disease that causes bones to weaken. It is also used to lower the risk of developing invasive breast cancer. What could happen? Drinking green tea while using raloxifene can reduce the absorption of raloxifene, which may affect how well it works. What to do? If you take raloxifene, check with your healthcare provider before consuming green tea or using green tea supplements.Related stories tea, chocolate, and 3 more foods that can help lower your blood pressure naturally. What happens to your body when you drink too much green tea? 5. Velcade, bortezomib. Break. Velcade, bortezomib, a type of targeted cancer therapy, has been shown to interact with green tea. Break. Why it matters. Velcade, bortezomib, is a drug used to treat certain types of cancers, including multiple myeloma and mantle cell lymphoma. What could happen? Green tea can make this drug less effective by preventing it from killing cancer cells. What to do? It's recommended to avoid consuming green tea while undergoing treatment with bortezomib. Check with your healthcare provider for more information and personalized medical advice. 6. Tacrolimus. Break. Tacrolimus, known by brand names including Prograf, Astagraf XL, and Envarsus XR, is an immunosuppressant that may also interact with green tea. Break. Why it matters. Tacrolimus is commonly used to prevent organ rejection after a transplant. Like Warfarin, it is an arrow therapeutic index drug. What could happen? There have been reports of green tea interacting with tacrolimus, potentially leading to elevated tacrolimus levels and increased immune system suppression, which could result in serious side effects. What to do? If you take tacrolimus, check with your healthcare provider before adding green tea to your regimen. 7. Sildenafil. Break research has suggested that sildenafil, brand names Viagra and Revatio, may interact with green tea. Break why it matters. Sildenafil is commonly used for erectile dysfunction, the inability to get or less than speak keep an erection, as well as pulmonary arterial hypertension, high blood pressure in the arteries of the lungs. What could happen? Some research has found that green tea increases levels of sildenafil in the body, which could potentially lead to more severe side effects, such as dizziness, headache, flushing, or prolonged and painful erections. What to do? Check with your healthcare provider before combining green tea and sildenafil. Green tea and caffeine. Break green tea and number 148, and many green tea supplements and number 148, also contain caffeine. Caffeine is a stimulant that can sometimes counteract or enhance the effects of certain medications. Be mindful of your overall caffeine consumption if you're taking any medications that also contain caffeine. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.